Good day, our viewers. My name is Mansour Ismail. Today we are on a live program where we'll be talking about the effects, implications, and management of abortion. But before we commence, I would love to introduce our visitors of today. So, sir, please can you introduce yourself to the audience?
Okay. Good day, viewers. Thank you for having me live on this program. My name is Bishop Dr. Nehemiah Bajune Boba. Thank you.
Thank you so much. And my mommy, please, the audience would love to know you better.
Okay.
Yeah.
Thank you, Vias. My name is Evangelist Dr. Peace Cheche Flami Bomara.
Okay, you are highly welcome, ma.
Thank
You are
you.
welcome, sir.
Thank you. my
We are
brother.
very excited to have you on this platform today, which it will be a very great opportunity for our viewers to understand some challenges which we know the people will do justice to the topic. So, as I said, today we are going to be discussing about abortion. This abortion of a teen has become a very rampant and like it's becoming even a normal life for some people, which it's very unfortunate. So, our doctor is here today to enlighten us about what abortion is and how we can actually get rid of it in our community. So, doctor, please can you give us more light on what abortion is?
Yeah. Okay. Thank you for welcoming me. Just like I told you earlier that my name is Evangelist Dr. Peace Ibomara Cheche Flem. When we talk about abortion, we normally say abortion here and there. But what is abortion? So we take it by its definition. Abortion is termination of pregnancy before the baby is being delivered. You understand? There is termination of pregnancy like from age of 20 weeks. So when the baby is not yet viable, when it's not yet delivered, you understand? That is the definition of abortion. So that is it. And we have so many factors, which are the theological factors that can lead to abortions.
Yes.
So when we talk about the theology, we'll take it in some aspect of it. Some aspect of it like genetic factors, you understand, or chromosomal factors, you understand, like Turner syndrome. So that you have is way of getting aborted children. That is, can abort children. Just Turner's syndrome, those children that are very stunted, those dwarf chromosomal deformity. Nature has a way of aborting some genetic factors, you understand? So those are the things that can lead to abortions, which is the theological factors. If you take it in maternal aspect of it, if you take it maternal aspect of it, you can see just like in maternal aspect of it, infections can abort a baby, you understand? If the woman actually is being sick, per se, maybe hyperparesia, which can induce abortion as well. Yes, it can as well lead to that. Then if you not take it in aspect of not only that, in maternal aspect of it, if a woman is having a kind of a iatrogenic service, or maybe iatrogenic, let's say, trauma to the womb, it can be aborted, you understand? So these are the things that can abort pregnancy. So but if you take it, the placenta aspect of it, if you have abortion placenta, it can be aborted, you understand? Abortion placenta, it can be concealed or revealed, you understand? Concealed means that the woman is having pain on the abdomen while she's pregnant, you understand? But actually the blood is not being coming out. It's concealed inside, you understand? That is abortion. But if you have a placenta previa, you understand, you will see that the woman is bleeding by vagina. These are the things that can abort the child. And also, as a woman, maybe if you are having if you're having pregnancy, cervical incompetence might also lead to abortion. You know, cervical incompetence the service is not, the os is open, you understand, and the baby cannot be able to contend. So the tendency of the baby aborting is there. And some of the factors that can lead to that cervical incompetence are overcuratage, you understand. Somebody that had abortion in the past and they overcurated the place, you understand, the person might not, the service might not be able to constrict itself. It might be open. So in that aspect, abortion might also still set in, except you do a kind of what we do, what we call a surgical operation. Chirurgical operation. You stitch the cervix. You understand? You doing using a chirurgical stitch, chirurgical stitch to stitch it. You can stitch it at the angle of 12 or 6 or 9 or 3, depending where you start. You understand? So that you like get the cervix and make it firm, so that the pregnancy will not come down.
But, okay, but I think some people used to mistake abortion for miscarriage.
Yes, they used to mistake.
Can you please give us
this difference? You know, abortion on its own is termination of pregnancy before 20 weeks, or a child that is that they're not allowed the child to be delivered before 28 weeks. They're not viable. You understand? So the miscarriage on its own is the pregnancy that was growing, and all of a sudden it aborted maybe nature. Nobody aborted it. Yes, nobody tampered with it. You understand? It just aborted on its own. You understand?
Very clear difference.
You understand? So there's a difference is clear. This one you did it by yourself. The other one you do not do it by yourself. You just have a way of doing it. Maybe some do some effect, that is effect like infections or something that can just cause that. You understand?
When maybe infection causes it, it can be called miscarriage. It will be difficult for some parents to understand that even at the time when they had abortion, they used to feel as if they have lost some part of their self, or let me say they have lost a very big thing which may not be recovered easily.
That is under spiritual aspect of it. You understand? They are feeling guilty.
So maybe, sir, please, what can you say to the audience on this aspect, on how they should easily accept the faith from God that this actually happens for a reason, and they should easily go by the instruction of the doctor, which, as you said, that sometimes the baby may not be in a proper condition.
That is not proper. It's not well formed. As a result of genetic or chromosome this in the problem. You understand?
So that is better. Maybe we can advise them.
Okay, thank you so much. Once again, as I said earlier, I am Bishop Dr. Nehemiah Buba. Yeah, the doctor had actually given us some instances. She has told us types of abortion. I might not go into that, but I want us to look at it generally. Whichever form or type of abortion that one has encountered, criminal, incomplete, inevitable, threatening, there is still hope. There is still hope. All hope is not lost, in the sense that, just as she concluded, one can go to the river, fetch water with a bucket. If the water got down, you can still go back. The most important thing is that whoever committed that abortion is still alive. Once the person is alive, that is where we say, when there is life, there is hope. When there is life, there is hope. If it is incomplete abortion, so to say, one can go back to his medical advisor and ensure that whatever remnant is evacuated, so that she can regain herself. Because men doesn't go for abortion, it's only women that goes for abortion. So she can go back and regain her hope by allowing herself to be treated.
This is the number one point.
Yes, to be treated. Then let's talk about the inevitable. The ones maybe the hate or whatever is not the way it's supposed to be, and it has been evacuated too. Yes, I believe that medically such parents could be advised. You come back together, and by the special grace of God, prayerfully, I don't believe it's a curse. Even if there were some things that developed to that extent, at least this time one will be guided. And by the special grace of God, you will discover that the next pregnancy will be a perfect one. So we have seen situations where some young ladies, maybe because they encounter such a situation, even if it is criminal abortion, some takes their life, which is not the best. Can still come back. I know, if not in the Western regions, in our own Africa times here, especially where we have major religions, Christianity and Islamic, I don't think somebody will come up openly like this and say abortion is allowed.
Exactly.
But one thing also that we need to understand is that there is no perfection in life.
Yes, exactly.
Yeah, there is no perfection in life. What you see, what prompts these younger ones to like hide after criminal abortion is they don't want to be exposed. But as you said, as you rightly put it, one needs to embrace what has happened, because you can't change it. You can't change it.
It has been destined.
Yes, you can't change it. And also, we'll also encourage maybe their peer groups, their friends, to accept them, because that is where they can redeem their hope back.
Exactly.
Because once that stigma is there, it can push one to do the unusual.
Exactly.
Thank you.
I still want
to
talk
you
about,
can tell us more on the implication of those
complications.
The complication,
Yes.
because some people used to feel maybe doing abortion has no implication. A lady may have up to 7 abortions.
Okay, so actually abortion has its own complications. You understand? Because one, you are tampering with uterus.
Yes.
And that's the carrier of your baby. So once the uterus is being perforated, infection must set in. So there's no point of committing abortions when it's not necessary. You know, there's no necessity in abortion. And the best aspect of it is these young girls that are readily available for all men should do what? Should be abstinence from sex. That's the best option. You understand? But eventually, if they are pregnant, there's no point of getting pregnant. There's no point of aborting the baby. You can carry the baby. It doesn't stop you from furthering your education. It doesn't stop you from being the woman you are. Because if you did not do that, on the process of going for abortion, they might overcorrect the uterus. The endometrial hyperplasia may set in. Endometrial hyperplasia, overcorrectage of the uterus. You understand? You might end up having Ashman's syndrome. That means the rate of conception is no longer there again. You cannot be able to conceive again because you have already evacuated the whole endometrium. You understand? So it leads to what? Infertility. You understand? So you know that the uterus anteriorly is the bladder, posteriorly is the rectum. You can be creating and you perforate the bladder. What have you done to yourself? You will leak forever. You'll be leaking urine from your uterus down to your vagina there. You can have that is vaginal fistula. You understand? It's very, very complicated. Some of them, yes, 2 problems. Some of them will even perforate the anus. You understand? The retrocecal aspect of it, they will be able to perforate it. So a lot of complications. So it's better. The best option is abstinence. But that is why we're coming into social factors. Abortion on its own has social factor implications. A woman who is busy smoking, what do you entail? What do you think that can happen? You abort your baby. If you are a drunkard, you can also abort your baby. If you are taking drugs, like women that are too much, drinking too much, so they should do what? Stop every social aspect of it, like smoking while they are pregnant, or drinking, or even drinking drugs, taking drugs. So you will not advise them not to do that.
Talking about communication between parents and their children. You know, sometimes I still come back to our culture in Africa. sometimes some parents find it difficult to sit down one-on-one with their children, like these female children, even male children,
exactly,
and talk to them. These are things we shouldn't hide anymore.
Exactly.
We should tell them the implication of all these things. By the time you communicate well with the child, prayerfully, I believe that it will
save him ahead.
Some of them do these things ignorant.
Yes, exactly.
Yes. Of course. That is why when they are growing, if you're a girl, while you are growing, your mom should sit you down and tell you once you initiate menses, you should be abstinent from any man. Don't allow any man to touch you so that you will not get pregnant.
And I believe our audience are enjoying this interaction. May God continue to intercede for those people who are in a very critical situation.
Yes, amen.
And we have been hearing about some of your good works.
Yes.
Dr. Peace and Bishop, you people are really doing well for the communities.
Yes.
And even the communities around you. May God continue to elevate you all.
Amen.
And we really appreciate your coming. Your coming is one in million.
Yeah.
Because what you have actually voiced out will save millions of people, billions of people, because we know it is reaching out to so many people out there. So may God return you back home safely.
Amen.
And we really thank you.
Thank you.
Lastly, I think you need to say goodbye to your audience.
Well, once again, thank you, audience, for giving us your attention. We hope, as our moderator has said, do not keep it to yourself. Ensure that you escalate it. See you next.
Thank you.
Yeah, that's nice. Thank you for listening. We'll be back someday. So it's a nice telling you what is abortion is all about, and wanted to keep to that. We don't want you to waste time. Don't die prematurely. Stop abortion. Stop it and make heaven. That's my goal.
This is what we call,
yes.
This is what we call supporting health.
Yes.
And inspiring change.
That is good. That is good.